Back in 1999, I was asked by the National Academy of Medicine, it was called the Institute of Medicine in those days, to serve on a committee that the United States Congress had voted to ask the Institute of Medicine to answer this question. When blacks and minorities enter healthcare contexts in the United States, does the race of the patient determine the quality and intensity of care that the patient receives? We found there were nearly 180 studies in published peer-reviewed empirical studies in top medical journals that had addressed this question. And not every single study, but 80% of them, about 80% of the studies found, yes, given entrance into medical care, some of the studies even statistically adjusted for the quality of insurance, the level of education. Some of them occurred within the same facility, so it wasn't differences by quality of care within the facility. Blacks and other minorities received poorer quality care and less intensive care than whites. It was a very striking finding. And the question is why? We did not, and I do not personally, and we did not believe that most healthcare providers in the United States wake up in the morning and say, how am I going to get my minority patients today? So that didn't seem to be the best explanation. But we looked at all of the science in the area of discrimination, and there had been a large body of research by social psychologists that documented a phenomenon that they call unconscious or unthinking discrimination or implicit bias. And what this research shows, this is not about healthcare providers, it's not about Americans, it's not about white people, it's about how all human beings process information. We process the complex cognitive information we face every day by putting things into categories. It's a shorthand way to navigate life. The trick is, if one of the categories that you put things into is a category based on your socialization, on the society in which you were raised and the things that you were taught culturally, is a category that you hold negative stereotypes about. The next two words are unconscious, important. When you meet someone who fits a category that you hold negative beliefs about without your conscious awareness, and automatically you will treat that person differently, and you are unaware of the fact that you actually did it because there was no conscious intent, it just happened. And most of us think of ourselves as cognitive, rational, intentional beings in terms of what we do. What research indicates, some experts, there's no definitive, but 80 to 90% of what we do is driven by beliefs that we have where we haven't consciously, intentionally decided to do X or Y. It's driven by things deeply embedded in our subconscious. And so we, at the time of the National Academy of Medicine report in 2003, it was the publication year, we did not have any direct evidence linking implicit bias of a clinician to clinician decision making. We now have had several studies since then that document this is real, this is robust, this matters, it absolutely happens.
That racism also has a profound impact on the neurochemistry of the individual.
Absolutely.
Which relates to all kinds of
Sure.
diseases.
Absolutely.
Help us understand kind of the scope of that as well.
Yes, so I've developed a number of scales to measure discrimination. One of them that has turned out to be the most predictive consistently of variations in health is called the Everyday Discrimination Scale. And what's striking about that scale, it doesn't capture big things like being stopped by the police or not getting a job or getting a promotion. It says in your day-to-day life, how often you're treated with less courtesy or respect than other people. How often you receive poorer service than others at restaurants or stores. How often do people act as if they're afraid of you or act as if you are not smart. It's 9 items, but little day-to-day indignities. And what we have studies now documenting persons who score high on a measure of everyday discrimination, a prospective study of adults followed over time. Everyday discrimination adjusted for other factors is an independent predictor of premature mortality. Everyday discrimination predicts higher levels of blood pressure. Pregnant women who report everyday discrimination give birth to lower birth weight infants. A study of the elderly followed over time, higher levels of everyday discrimination predicts more rapid declines in cognitive function over time. I could go on and on of research documenting in a broad range of health outcomes that the experiences of discrimination have negative consequences for health.